Well, what's so special about platelet-rich plasma is it's your blood. It's not a chemical, it's not toxic, you can't reject it, and you won't get an infection from it because it's your blood. The platelets in your blood are very important cells. We always thought they were just for clotting, but actually platelets help heal the body. If you damage your tendon, your ligament, or your cartilage, it can help regenerate that tissue. Platelets are one of the minority cells in your blood. There's red blood cells, white blood cells, platelets, and of course the fluid around it called plasma. What we do is we concentrate those platelets by taking out the red cells and the white cells, by taking 20 to 60 cc's of blood, 2 or 3 tubes of blood from the patient, and we put it into a kit and we concentrate it, throwing away the red cells and most of the white cells, and we're left with about 1 million to 1.5 million platelets per cc. And that's very important that you get that concentration, because ultimately that's what releases growth factors that help the tissue to reheal.
And then once you have that PRP or platelet-rich plasma separated out, what do you do with it?
Well, what we do is if the patient, for example, like Dan, has a shoulder injury, we'd find out where exactly the tissue needs to be healed. If he has a tendinitis or tendinosis, a chronic tendinopathy, or a bursitis, or even arthritis in the joint, I do my injections under ultrasound guidance, where we actually watch the needle go into the joint right next to the tissue that's torn or degenerated, deposit the platelet-rich plasma, and then allow it to heal.
And then whenever you inject into that point in the body, what exactly does the body do to heal? How does that process work?
Well, we're finally starting to understand exactly how the body heals, and there's generally 3 phases of healing that occur once you inject platelet-rich plasma. And actually it's the same type of healing that occurs once you get injured. There's initially an inflammatory phase where the platelets release growth factors to call in stem cells and other tissue to start laying down a matrix for the wound. The second phase is a proliferative phase where the cells start to mature and replace elastin, reticular cells, and collagen to heal a tendinitis, an arthritis, or a bursitis. And then the final phase is called the remodeling phase, where the new tissue matures, strengthens, and becomes more dense.
So you mentioned arthritis and tendinitis and bursitis earlier. Are there other things that PRP can be used for?
PRP has been used for about 20 years. It actually started with dentists to reconstruct mandibles for cancer patients. Then cardiothoracic surgeons began using it in sternal wounds after they did a heart transplant to keep the patient from getting an infection and also to heal the bone. PRP, again, it's your blood, so it actually fights infection, which is very nice. And anytime you do an injection, that could be a potential complication, infection, and the result is much, much lower using PRP.
And then what is the success rate that you typically see with patients in terms of getting them out of pain?
Based on the literature and the conferences, as well as my own use of PRP, about 80% of the patients get a significant response. What I tell my patients are 80% of the patients get a 50 or 60% response from PRP. It's my own experience, at least 90% of my patients have gotten a positive response, well over 50%. Anytime we do any kind of treatment, we always look as the risk worth the reward. And we try to get patients to decrease their pain by half or increase their function.
And you mentioned earlier in stage 1 stem cells. Well, that's something that we hear a lot and have heard a lot. Could you tell us a little bit about what stem cells are and what they do and how they work in this process?
Stem cells are cells in our bone marrow that can become any cell. You know, I heard a good analogy at a conference recently where they said a stem cell is kind of like a wild card or a joker. Anytime if you have a hand of 4 aces and you bring in a joker, it becomes an ace. If you need another king for a full house, that joker becomes that card that you need. So a stem cell becomes the cell that your body needs to help heal itself. If it's a chondrocyte or cartilage, the stem cell can become cartilage cells. So we tend to call them in with those growth factors and actually heal them. Most recently, they actually found stem cells in the platelet-rich plasma. So we're actually injecting stem cells now.
Right, wow. And is this PRP therapy considered the normal standard of care for people with pain, or is it considered like an alternative therapy?
Really, it's neither. It's certainly cutting edge, brand new technology that we're using, particularly by separating and getting the appropriate concentration. So it's not the typical therapy or cortisone shot, and neither is it alternative because it's your blood. It's all natural, it's not a chemical, it's not something we synthesize. In Europe, for example, it's considered a standard of care. We're a few years behind with our research.
And whenever you're doing the injection, with a patient. Is that something that's painful, and is the recovery painful or the healing process painful?
That's a great question. Essentially, no. The most painful part of the procedure is actually taking your blood, and we send everybody here at Benia Community Health Center to the phlebotomist, which they do 100 times a day to take for cholesterol or sugar, things like that. And once they take the blood, that's the hard part's over. And then we spin it down, and what's nice is we use musculoskeletal ultrasound to guide the needle. So we don't have to fish around with the needle to know where to place the medicine. We don't have to go against a bone or cartilage, which could hurt, frankly. We use the ultrasound to watch the needle go in exactly where the tear is or the degenerative arthritis is, and we place the medicine. So the injection, with rare exception, patients are surprised how little pain is involved, just like Dan said.